Hello there, I'm Dr. Jim. My topic today, depression and neurodegenerative disorders, the importance of early detection and better outcomes. Good one, right? Symptoms of depression are common with chronic illnesses, especially the neurodegenerative disorders like Alzheimer's, Parkinson's, Lewy body disease, vascular dementia, frontotemporal dementia, and others. Some individuals will exhibit symptoms very early on, which may be associated with a higher risk for developing the disorder. And some will express depressive symptoms later in the course of illness. Now, big connection, brain, mind, mood, behavior. According to research, depressive symptoms play a significant role in neurological disorders, especially in the neurodegenerative diseases. This is true because of the connection between the physical brain, our mind, how we think, our behavior, and our mood. For some individuals, depressive symptoms may occur very early in the development of the disorder without any presence of cognitive decline at all. That's important. Depressive symptoms occur early, no sign of cognitive decline. There's bad news and there's good news about this. Depression presents a challenge when it occurs with neurodegenerative disorders. It can create a negative impact on the individual's quality of life and lead to stress and burnout of the caregivers, right? Both formal and informal caregivers. Depression is also associated with decreased functions and cognitive abilities. That's the bad news. The good news is that depression is treatable and early detection can lead to the start of appropriate treatment. Catch it early, treat it early. It may actually improve perceived health status and well-being of the individuals when you catch it early. Now, there is some diagnostic difficulty involved here. Depression may be challenging to diagnose when it occurs with neurological disorders, and especially the neurodegenerative ones. Symptoms of depression might be mistaken for cognitive decline, and vice versa, by the way. Individuals who have such disorders may find it difficult to communicate symptoms accurately. They may be unable to distinguish among feelings like anxiety, panic, lack of concentration, motor disturbances, and indecisiveness with real feelings of depression. Now, let's get that clinical picture even muddier. Why not? Biological symptoms of depression, biological symptoms, not thought symptoms, such as weight loss or sleep disturbance, may also be a part of the clinical picture with or without any disturbance in mood. Now, they're usually associated with mood disorders, but maybe they are not. Some individuals will develop apathy, which is commonly mistaken as anhedonia, which is a marked decrease in interest or pleasure in things that they used to enjoy. They're not the same. Language problems can also make diagnosing depression difficult, as can pseudobulbar palsy or pathological crying and emotional instability that we see with some of the neurodegeneratives. My takeaway, depression is common among people who don't have neurological disorders whatsoever. It is also common among those who do, and especially people with neurodegenerative disorders that are increasing around the country due to the aging of our population. While it is challenging to sift through clinical symptoms of these conditions and conclude that a true depression is present, it's very important to try to catch it as soon as the clinician possibly can. Only then can decisions be made about treatments, therapies, and improving quality of life, which we're all striving to do every day. That's my aim. That's my goal. I'm Dr. Jim. I'm out. I'll see you soon.